Larry joins us live from Kroger Field with more. Good evening.
Well, Nancy, let's start with that. Here's a quote from one of the officials I spoke with today. This will get better in a couple of weeks. Now, certainly there is some reasons behind that. I'll get to that in just a moment. I'm here right now at the Wild Health testing location here on the UK campus, right across the street from Kroger Field. This is a site that's become all too familiar to us in these past, 18 months or so. They'll administer 3,000 tests today alone, but that number is down from the 4,000 that they peaked at last week. It's one of the signs, though, that they think that Omicron's worst may be behind us.
2 weeks ago, they started to climb significantly. Last week, they were at an all-time high in terms of the difficulty because of the weather on top of the demand. Now the demand is still high, but it's not climbing anymore, so we're appreciative of that.
Wild Health's Luke Murray has been counting tests at this location far longer than he ever imagined.
I thought I was going to be out of a job over the summer. I actually started planning to step away and wind us down, and it ramped up, and this is hands down the busiest month we've ever had, both with vaccinations and with testing.
And it's not just in Lexington. Today, Woodford County distributed 350 free at-home tests.
Hopefully we'll get more next week, and we'll do the same thing. As they come in, we'll get them out.
Thank you for all you're doing.
All right.
Appreciate it.
Have a good day.
In 10 minutes. Some waiting in line more than 5 times that, up to an hour to get their kit.
I really appreciate it personally. I know I've worked hard the past roughly 2 years to keep myself and my family safe, and I appreciate the community doing the same.
Some believe it's a change in attitude that's fueling the demand, but Murray has a different theory.
I think it's a matter of necessity that people at first should have been getting tested more. We were surprised when the numbers jumped up to 10%. We didn't have nearly the testing demand. Then when they hit 20 and 30, people finally started showing up because they were symptomatic, not just exposed, but actually had symptoms. So I think that's really why we've had this amount of demand.
Murray says last year the volume from January to February dropped more than 50%, and he expects a steeper plummet this year thanks to the high number of cases due to Omicron. And after a peak of 4,000 tests a day here in the snowstorm last week, he and his staff look forward to a boring 2,000 per day. And just to show that Murray still has a sense of humor despite all this madness, he said another reason he thinks that Omicron is on its way down. He said with positivity rates in the high 20s, pretty soon we'll run out of people to catch COVID. Just one more way to look at it.